really good to see you all, and I hope you're all managing okay. So it's been unbelievably 3.5 months since we all went into lockdown. March the 23rd, I think, was the date, and from that day onwards, all our lives changed. Things are slowly getting back to normal, but certainly my working life has changed as a journalist, and I know Ian's has as well. Ian's been working for BBC, as I have, during this time, and there have been huge changes. And I thought it'd be good to go through some of the changes with you, because it may have some impact on how you're going to work next year. It may not, but it may. So I'm not sure whether you're all aware, but journalists are actually key workers. They were on the government's list as key workers, which it actually surprised me, and I always feel a bit embarrassed when I say journalists were key workers, because it's not something I throw around, because I don't consider myself as a frontline key worker, certainly not saving lives, certainly not the NHS or a carer or anything like that, or a delivery driver. But nonetheless, journalists were on the original key workers list. And I guess in a way, you can understand that, because we are getting information out. We have to be out there getting the information out to make sure that the government's government information is put out to everyone. So you can tell your parents that you are doing a worthwhile degree. It is a key worker degree. But much of what we've been doing as journalists, like I said, is getting information out there. And it's changed. How we get information out there has changed, and our job has changed. So as you've all done interviews with people, you're all aware of this, but much of what broadcast journalists do, especially TV reporters and radio reporters, involves going out and about. It's all about meeting people and chatting to people and going into their homes. It's what we do. And I didn't realise until the restrictions have been placed on me that it's a really intimate job. When I'm working, I put mics on people. I go and mic people up, as you've all done. You put your radio mics on people. You move people into position. You quite often physically touch people, just move them here and there, check their mics. And it, like I said, it's something I never really thought about before. But actually, much of what I do, and you as trainee journalists, involves being closer than 2 meters away. But of course, we can no longer do our job as we did it before. There are a lot of health and safety considerations that we've got to adhere to now, for our safety, our colleagues' safety, and the people that we're interviewing as well. And there are so many considerations that now have to be worked through. I've been working as a reporter, so I've been sent out by producers. Now, I've not been working much as a producer during this period. Ian has. So Ian can probably tell you more about how it's changed for him as a producer sending reporters out. Have you noticed, Ian, that it's become a lot more laborious, a lot more difficult for you?
Yeah, so the number of checks has gone up, basically. So every time we send a reporter out, we've got to do a risk assessment, and it is very similar to the way that you risk assess borrowing equipment. The kind of options that we've got, looking at lone working in crowds, trip hazards. I know a lot of you are fond of trip hazards. They often come up on your risk assessments. But we've got to go through that. And the list has basically grown. And also there's kind of common sense that applies. I mean, a lot of the strongest stories that we've been doing, a lot of stories we've been sending people out to have been related to coronavirus. So obviously, if you're reporting on, as we have done, people going out into the countryside, around Yorkshire, going to the coast or the Yorkshire Dales or the North York Moors, to get out and get some fresh air, and perhaps in numbers that they shouldn't be going out in, and perhaps leaving a mess behind them, as they have done in many cases, causing congestions in small villages in the countryside. That was one of the stories for a while before the lockdown measures were changed. Clearly, if we send somebody there, then they're going to add to the problem. They're going to add to the congestion. they themselves could be in a situation where social distancing isn't observed, so it's a threat to their health. And the BBC and I, as a producer, I'm responsible for that. I think as well that not everyone's going to react well necessarily to being filmed if they kind of glean that the reporter's there to look at the way the beach is crowded, or you know, the way that people have parked and blocked the roads, or whatever it might be. They may feel that they're under the spotlight, that member of the public. You could get an angry reaction. So you've got just a lot more to think about in advance of sending somebody out. And whereas in the past it'd just be a quick call to a reporter saying, could you go here, this is the story, this is the person you're going to meet by, it's probably now more like a 10-15 minute conversation, thinking through all the consequences of what it is we're doing and how we can do it safely. I would have to say it's never stopped us doing the story. It's never stopped me doing a story. And in some ways, some of the changes that have happened that I think Anna's going to touch on later have in some ways made it easier to cover some stories. You might find this as well. There's been a bit of a trade-off. I think there were some things that we've done along the way because we've had to do them, but actually they've pointed us towards efficiencies that will probably keep with us in the future. So yeah, so more laborious, it feels more risky, longer conversations about whether or not we can and how we would go about doing a story. But it's about finding a solution. It's not about not doing journalism. It's about carrying on doing journalism because we have to, but in a safe way and in a way that's going to be respectful of social distancing and everything else. Okay.
You've not stopped any journalists going out then, Ian? You've not said, no, it's not safe. You've always found a way to get reporters out there.
I've asked them if they feel safe. I think the kind of one that I had most reservations about was a colleague who works as a video journalist, so a lone worker, who wanted to go out to Burnsall in the Yorkshire Dales because a lot of people have been going out there. It become very crowded, very congested. People were leaving litter. The toilets weren't open, so people were doing what they had to do, going where they had to go to the toilet. It really wasn't very pleasant for local people. She wanted to go there and do the story, but doing it by herself just kind of worried me. However, we talked through a strategy, and then one of the things that she did, she had a point of contact. So she wasn't just turning up, not knowing anybody there, and sort of having to find the bearings on the ground. She knew in advance somebody who lived there. So we agreed that what she could do is go there, go and visit that person, and from their property, from their garden, get enough shots to be able to tell the story, and also to be able to get an interview from them. So to use that as a kind of base, and then if she felt safe, to go out into the wider community, to go out into the village and gather further shots if she felt that she could do. And in the end, she did actually. It's an experienced reporter, and it's somebody who's not, not a risk taker. So I trusted her to use her own judgment, basically in that situation. And she was fine. She did a great piece. It went. A lot of the stuff that she shot that day went onto Network News as well as being used in Yorkshire.
Okay. So as Ian said, the commissioning is a lot more laborious, and as is the job of the reporter as well. I can no longer just be commissioned. I can no longer get a story commissioned and off I go. I have to talk it through, and a producer can no longer just send me out like they used to do. Everything has to be talked through. It's laborious and it's a bit of a drag sometimes, but we have to go through it. For example, I was working with a teacher in the Vermontos area of Leeds, and she was going out delivering food to some of her pupils whose parents were struggling because they'd been laid off during the pandemic. I wanted to put a radio mic on her. In the past, I'd have just gone up to her, put the radio mic on, clicked it on her, and then off we'd go. But of course, we couldn't do that. So I had to disinfect the microphone so she could see me disinfecting it, put it into her front garden. She then had to pick it up out of her front garden. Then she had to clip it on herself. I had to tell her how to do that. Luckily, she'd done TV interviews before, so she knew how to do it. She knew where to put it. So that was at least something. We did the interview. Then she had to take off the microphone. I had to see her disinfect it. Then she put it back into her front garden. I had to pick it up with some gloves on. Then I had to disinfect it. Then I had to put it in the boot of my car. It all sounds over the top, but that's the process we had to go through. And in fact, the bosses, the editors at the BBC don't really want us using radio mics at all. So that was a kind of one-off. We're not really encouraged to use radio mics. We're encouraged to use the boom mics, which I'm sure you've all seen on TV at the moment. I will just play you something if I can. Just some shots. Can you see that? Yeah. This is what it's now.
We're looking at the homepage of the Zoom call.
Okay.
Rather than the video.
You see that?
No, it still hasn't changed. Probably have to go out and come back in again.
Oh, yeah.
Just whilst we're doing this, folks, if you've got any questions along the way, then there's the chat facility here. So at the bottom of your screen, you'll see the chat button with the little bubble there. So if you've got any questions that you want to ask but don't want to disturb Anna as she's talking, then put any questions into the chat. I'll keep across it, and then we'll answer those questions when we next have a little gap. Okay, thank you.
Can you see Charlotte?
Yeah, we can see that now.
Brilliant. So sorry about that. As I said, most of the stuff we're doing is being done with boom mics. And as you can see, my colleague there, Charlotte, she did the interview through a window. There's lots of that's going on at the moment. Even though the social distancing has changed, it's gone down to 1 metre. BBC and other media outlets are still sticking to 2 metres. All this was shot during the time that it was 2 metres social distancing, but it's still exactly the same now, even though we've gone down to 1 metre. So as you can see, interviews now have to be done outside or in somewhere big enough to social distance. No more filming in people's houses anymore, and it's all about gardens now. It means that the interviews that we used to do are a bit more intrusive and off-putting for the person we're interviewing, because we have the big boom mic, we're not as close to them as we were before. We as journalists have other considerations going on, you know, are you 2 metres away? Is the boom mic working? So you lose a bit of the intimacy that we used to have, and some of the interviews aren't as emotive, I don't think, because there's quite a bit going on. It's also harder for the journalist. Sometimes we have someone helping us, holding the boom mic, but quite often we are holding the boom mic ourselves, and they can get quite heavy. So you're trying to do an interview, but you're also holding this boom mic, which is making your arm ache. It also means that video journalism, something that I do a lot of, is a lot more difficult, as Ian mentioned about Olivia going and filming in the Yorkshire Dales. It's not as easy to go out on our own anymore. We're tending to go out with other people. And as you'll have seen on the news, I'm sure, we have to be seen to be social distancing as well. It's no good doing pieces thinking that we can get away without social distancing. We have to be seen to be doing it. And so that means that once we've done a piece, it has to be reviewed by a producer to check that there are no, glitches in it, that, oh, you've not social distanced there. And as I'm sure you've all seen, a lot of the shots on the news, they're deliberately showing the social distancing. So they're showing a wide shot of the reporter and the interviewee, just to say, yeah, we are sticking to the rules. Obviously, it's quite difficult now, and I've deliberately stopped on this ironing board and computer because that is obviously a Skype call. It's not my ironing board, by the way. And because of the difficulties in interviewing, we are doing a lot more Zoom calls, Skype calls, FaceTime interviews. And this is something that in the past we would have only used as a last resort because they weren't good enough. It's something that we might use if someone was abroad and we just couldn't get them. Now we're seeing them all the time. They don't look great, but we are getting used to them, and it just shows you, that we are now used to our news looking a bit different, and our standards have probably dropped slightly. So yeah, that's a Zoom call. We get that. We accept that. They don't look great, but we can make them look better. And this is something that you guys should consider as well, just in case you do have to do Zoom calls and do interviews for your final documentary, you might have to do this. So there are things that you can do to make it look better. What you will have seen, I'm sure, is loads of shots of people's ceilings and the interview being done up someone's nose. There isn't really any excuse for that now. We can do something about that. So if you are going to do a Skype interview with someone, and it is for a piece, especially if it's your final documentary piece, get the other person to put their phone or their laptop on some books so it lifts up a bit more. That's what I've got at the moment. Speaking to you, I've got my laptop on a few cookery books. So get them to do that. They can do the same with their phone. Make sure that you don't sit the person in front of a window, because then they'll just be silhouetted. Make sure that they've got a bit of light on them though, so there can be light coming from a window onto them, but don't sit them in front of a window. You could get them to put a lamp on themselves or anything, and also get them to check, maybe put some things in the background or something. But those are things that you can do to make the Skype interview or the Zoom call or whatever look a bit better. Of course, one of the most challenging things at the moment for journalists, but one of the most important things at the moment is, I guess you'd call it reporting from the front line, and that is reporting from the hospitals. That's where it's all taking place, and that is really, really difficult for us as journalists, because that's at the heart of that's where the pandemic is. That's where we have the most health and safety risks, but we have to be in there. I'm going to share with you, if I can, a piece that a colleague of mine did, a guy called Jamie Coulson. He's a health correspondent for BBC Look North, and he was given exclusive access to a COVID ward in Bradford. So I'll play this for you. It might lag a bit. Let me just see. Can you see anything yet? No?
We can just see the file explorer.
Okay. There you go.
That's
so this is Jamie's piece. Yeah.
Thank you for joining me first tonight. BBC Look North has been given exclusive access to a Yorkshire hospital which is taking part in the world's biggest clinical trial tackling COVID-19. Bradford Royal Infirmary is recruiting patients into the recovery trial, which is being coordinated by Oxford University to see which drugs might work against the virus. Here's our health correspondent, Jamie Coulson.
This is the main COVID ward of the hospital, where we've been treating patients for the last 4 weeks. And this is the door which gives the names of all the patients who we've got better and gone home.
At Bradford Royal Infirmary, this is the front line of the fight against coronavirus.
This is a 4-bedded bay, and we've got various patients on various stages of their treatment.
Dr. Dinesh Saralaya is an expert in respiratory medicine. For the last 6 weeks, he's witnessed an onslaught of patients with COVID-19.
It's an extremely frustrating situation, because here we are seeing a disease which has been with us only for about 6 weeks, and there is no proven treatment at this point of time. So all we're doing is supporting the patients with their disability and their infection. And as you will see, there are patients who are getting better. There are patients who have only a mild illness, and we have got a large proportion of patients who are actually very sick as well. Is your breathlessness much better?
63-year-old Thomas Levitt has been in hospital for 2 weeks. Virus has not only left him struggling for breath, but cut off from loved ones.
Yeah, I haven't seen my wife for 3-4 weeks, which is not good. And I haven't seen my granddaughter or my daughter 3 or 4 weeks, which is not good as well. So, I don't know what to do. Can't do anything. You've got to grin and bear it.
I've been practicing my specialty for 25 years now, and this is probably the first illness where I've found that times I'm completely healthiest, because the illness seems to take a course of its own.
All of the patients on this ward have been through a frightening ordeal with COVID-19, but many of them are now playing a vital role in the fight back against the disease.
This trial is investigating what is the best treatment to get people like you better.
Bradford Royal Infirmary is one of 170 hospitals recruiting patients into the recovery trial coordinated by the University of Oxford. It's the world's largest randomised clinical trial to find an effective treatment.
This is called Kelettra, which is an antiviral drug used in patients with HIV.
Each patient is either given standard hospital treatment or that same care plus one of 4 drugs, which include an antimalarial, a treatment used for HIV, steroid typically used to reduce inflammation, or a commonly used antibiotic. Another anti-inflammatory drug will soon be added.
There is no exit strategy for this virus till we get a vaccine. So what this trial will tell us, which of these treatment arms is beneficial to our patients, which will prevent them from coming to harm.
The vaccine is our prevention strategy. Our treatment strategy, we need drugs that work, and we don't know what works.
Professor John Wright leads the Bradford Institute of Health Research.
How important could the findings of the recovery trial be?
There has never been a medical research study as important as the studies that we're doing for COVID-19. We do not have an effective treatment for COVID-19. We need it urgently. Patients in the wards who are dying day after day need treatments to save their lives.
He is much better. There's oxygenation. He's on a peak of 10.
57 patients have been recruited in Bradford, with nearly 7,000 taking part nationally.
Any way we can come together and fight this will be a positive step.
There are times when we feel completely helpless, when we see the patient deteriorating in front of our eyes. So it's so crucial to do these trials so that we can actually find an effective treatment for these patients. The recovery trial has been like a ray of hope.
In this pandemic, which has claimed so many lives, this research may help determine how many might now be saved.
Well, Jamie Coulson.
So that was Jamie Coulson there reporting on coronavirus at a hospital in Bradford. As I'm sure you could see, it was a big operation. I asked Jamie what it was like to go to the hospital, what sort of things he had to do before getting permission from both the hospital and the BBC to go in, and he said it was, I think he said it was reams and reams of paperwork, and he had to have someone help him, a producer, work on it to get it all sorted out. This was at the height as well, it was at the height of the pandemic. So he said there was lots of health and safety form filling that went on. And he said himself personally, he had to consider things like being cleanly shaven. He had to strip at the door and put all his clothes straight in the wash. And he had to be mindful of symptoms for 2 weeks afterwards, and was encouraged to stay out of the office. Interestingly as well, he said it was everything about the shoot was 10 times more difficult than a normal shoot. And when you watch that, you can see why. And as a reporter watching it, I think, God, that must have been so difficult going through all that. Communication is so difficult. It was difficult to hear the people talking with all their PPE on. It was difficult to hear the doctor talking. It was difficult to get the actuality of people talking. Even Jamie's piece to camera, which you could tell what he was saying, that was quite difficult for him to be heard. And he said he had to do that a couple of times. He also said the PPE was hot and uncomfortable for him as a reporter. So, and goodness knows what it's like for the doctors and the nurses wearing it for hours on end. Another thing that I didn't consider was that it was quite difficult for him to get consent from the people on the wards because of communication. So the patients that he spoke to, it was difficult to get them to consent because he couldn't see, sometimes he couldn't make out whether they were saying yes or no. So that wasn't as easy as it would normally be, because it's normally, yes, I agree to it, and a tick, but of course they're ill, and also you can't see what they're saying in some cases. So there had to be a lot of double checking on that. So that's the first barrier, the first difficulty. But also, Jamie had a difficult story to tell. Aside from all that, he had to tell this quite a tough story about clinical trials while thinking about the PPE and everything. So if you do, I mean, I think at this stage we're thankfully we're coming out of lockdown and things are easing a bit. And I hope that when you come to do your final documentaries this year, that we won't have as many restrictions on filming. But if we do, it's really important that we're really organised and we think about things like this and we think, ahead. But it just goes to show you that we can still report during this time. There's absolutely, if we can go into hospitals and do things like this, we can do, but we have to be organised. But like I said, let's hope that when it comes to your final documentaries, that you're not having to jump through those sort of hoops. So that piece is reporting from the front line. That's obviously the top end of a news story, a news bulletin. It's really important. It's a gritty, hard story. But not everything that we've been doing during the pandemic has been like that. So Jamie's is at one end, and at the other end, going from one extreme to the other, we've got the COVID wards in Bradford, and then we've got kitchen raves in Leeds. So we still having to tell stories from both ends. So we've got our top stories and our bottom end stories. The top stories, like Jamie's, where we need to be out, and we need to be out into the hospitals, have to be told. But there are other stories that actually we still need to tell, but we probably don't need to be going out and about and putting ourselves at risk and filling in loads of health and safety forms. So the next piece I'm going to show you was put together entirely using phone footage, WhatsApp clips, and Facebook footage. The voiceover was recorded on a phone, on a mobile, underneath the duvet. That voiceover was then emailed to an editor who was in an edit suite on his own. And the edit took place over the phone with me saying, could you put that shot there? And him talking to me, and then he'd go away for 20 minutes and come back and show me what he'd done. And that's how we communicated. But everything about this next piece was done remotely. There wasn't a single face-to-face interview. And it just goes to show, again, this might be something that you have to think about when you do your final piece, that there are ways and means of doing things. And I'll just share this next one with you.
A DJ from Leeds has found a way to ensure we keep dancing. Dale Castell, who usually can be found behind the decks at Fibre Nightclub, is now got himself a new DJ booth.
There we go.
A DJ from Leeds has found a way to ensure we keep dancing. Dale Castell, who usually can be found behind the decks at Fibre Nightclub, has now got himself a new DJ booth for the lockdown. It's a far cry from what he's used to, but thousands of people from around the world are now enjoying his virtual raves. Anna Crossley reports it contains some flash.
It's not where you'd usually find one of Yorkshire's busiest DJs, but like so many of us, Dale Castell's working from home. Well, his son's bedroom, to be precise. When all Dale's gigs were cancelled, he decided to carry on live streaming his DJ sets on Facebook.
I'm so used to DJing in a club or a bar where I can see people, and now I'm DJing to a wall of Transformers posters instead. But actually, once the stream starts getting going and everyone's interacting and you're doing your shout outs, it becomes a place of positivity and happiness, and everyone's having fun. And even though you can't see them, you know they're there, and it's been absolutely fantastic.
And it seems people aren't put off by the toys. They're just happy to be dancing. in kitchens, gardens and front rooms all over the UK. At any one time, Dale usually has around 3,000 ravers of all ages watching him DJ. So far, more than 500,000 people have listened to him since the lockdown started.
We've had messages from people, not just in Yorkshire and not just in England, but overseas as well, saying thank you for the music and telling us how much of a positive influence this music is having on them, the families and the mental health as well, which is obviously amazing to hear. And also families saying that they've been clubbing with the kids, which is something they never thought of them do before. And it's just been a really fantastic, positive experience.
So, what does Leo think about his dad taking over his bedroom?
It's really cool and good music.
Like, you're getting distracted. I'm thinking about the amazing party we're all going to have after this.
But with pubs and clubs unlikely to reopen anytime soon, kitchen raves are the best we can hope for right now. Anna Crossley, BBC Look North, Leeds.
What a great idea, and Dancing with Peppers is certainly...
So there you go, that's one extreme to the other. Jamie's very important hands-on frontline piece to the piece I did that was not very important at all, but nonetheless it's still, we still need to have that light and shade during times like this, and Jamie's was hands-on and mine was completely hands-off. The sound wasn't great, some of the shots were wobbly and a bit dark. It was all done remotely, but it was really well received, and it just goes to show that actually we can, I would, you know, if you'd have said to me say 5 months ago that you would put a piece out that would go on the news and go online, that that was made up completely of Facebook footage and WhatsApp clips and things done on the phone, I wouldn't have believed you. And I'd be recording the voiceover under a duvet in my son's bedroom. I was thinking, no, that wouldn't be good enough. That wouldn't go on the telly. But actually, we have managed to do that. And also, it's interesting as well, the people that we're interviewing now, we're getting them to do things as well. So, for example, in that piece, you saw a lot of the opening shot was the little boy's bedroom, and there was a move, there was a pan round from the teddy to the mixing desk. Dale, the DJ, did all that. So I sent him a message and said, can you get these shots for me? Can you get a close-up of the transformer? Can you do this, this and this? This was just on text. He did it all. He filmed it for me, and then he sent me the shots, and then I got back to him and said, oh, could you get another of the transformer, or could you get another of the teddy? And then he sent me more. So he filmed it. So we can now, like I said, a few months ago, I would never have considered getting the contributor to film things. But actually, people's phones, a lot of people have decent phones now, and they can do that. So we can ask people if they mind doing it, and he was happy to do that. It was a joint collaboration with someone in the office at the BBC in Leeds. They were editing it, and they were getting the Facebook footage in. But yeah, a lot of it was done on phone and through Facebook. Now, I've hardly been in the office at all during this. I think during the whole pandemic, I've probably been in 2 or 3 times. And like many reporters, everything I've done has been from home, or I've been out filming, and then I've come back and I've sent voice track from home. Now, Ian's been in the office a lot more than I have. I think you've been in most weekends, Ian, I think, or every other weekend. You seem to have been working a lot. What's it been like for you in there? Has it been very different? I've seen some pictures of it all.
Yeah, I was worried at the first time I went in. It was scary because I've been in my house for 6 weeks, more or less. It was quite daunting, quite frankly. But we pretty quickly kind of got over it, I suppose. I mean, by then the BBC was 6 weeks into having reorganised the studio and the newsroom so that it was safe. So by the time I got there, they were very much on top of things. I mean, bear in mind, as Anna said before, you know, journalists were identified as being key workers. Being a key worker doesn't just mean that you can carry on working during the pandemic. It means that you must. You have to carry on working during the pandemic because what you're doing is so important. It pays such a big contribution to, you know, to life in this country and to our being able to cope as a society with coronavirus. So they had to adapt from, you know, overnight basically. And every time I go back, I'm working more or less every other weekend, and every time I go back, there's something new. They've added something else to their kind of arsenal of precautions. So I just wanted to share some of them with you via a PowerPoint. Do shout out, Anna, if this doesn't work. Hopefully you'll be looking at a PowerPoint slide now.
Yeah, got it.
Cool. So this is the outside of the BBC building in Leeds. Over here, this split screen, literally a revolving door on the front of the building. Some of you may have been there before and seen it. But not so much a revolving door now in terms of guests, because they're not allowed in the building. So it's only staff who are allowed in. So another reason for the increase in the number of remote interviews that's been done is because people can't come into the studio to be interviewed. Once you get inside the building, the first thing that you have to do is get your temperature checked. So this is the other side of that revolving door. Luxmi Gopal, one of the presenters on the programme, very happily for the purposes of this and other things we'll do on coronavirus, takes lots of pictures behind the scenes, and she's taken one here of her having a temperature checked. She comes in at 33, that's fine. I think the cut-off's 36. If it's 36 or higher, you get to go home. Yeah. So it has crossed my mind. I mean, if you weren't fancying it that day, do you go for a jog around the block? Do you sprint up the road, come in, get your 36, yes, and then go home? I haven't tried it yet. Anyway, if you're below 36, you're fine, so Luxmi goes in. I wanted to, where is it now? Can I get to it? Show you a quick video that she's done. This will disappear from my screen. Maybe I won't do that. Technology's got the better of me. Basically, you walk into the building, you walk up to the screen, you get your temperature checked. You then go through a set of doors, and the newsroom's on the first floor at the BBC in Leeds. So you've got this little stairway here, and as you can see, there's yellow tape everywhere, indicating people have to stand on the left, and you try not to pass each other on the stairs if possible. You can see people coming from down here. So on the little landing here, you stand in the corner, facing the wall, ashamed, face turned away, and you let the person walk past you. I don't know if you do actually have to stand facing that way, but anyway, that's how it's marked up. You then go onto the first floor. So this is where the newsroom is. This is a door into the newsroom, and right by it, as you see here, is hand sanitizer. And there's hand sanitizer pretty much everywhere around the building, on every desk. You go into the newsroom, and these arrows very clearly indicate where you've got to go, and the arrows lead all the way back round here, in a loop round. So there's a one-way system within the building. And I should add, this is the kind of thing that we'll do at the university as well. So it'll be these kind of measures that the university will put in place to allow us to do some face-to-face teaching next year. Okay, another big difference is there are far fewer people in the newsroom. So the only people in are people who have to be there. So we've got Michael Wood here, who did your presentation training earlier in the year. So he's got to be in there to direct the programme. And Luxmi Gopal here, the presenter, she's come in as well. And I'd be in there as a producer, and there's you know, a few other people as well who have to be in the office. The technical team who organise the studio and get the programme on air, they have to be in the office as well. The way this newsroom is organised is that you typically have kind of islands of about 6 different desks on each island. So you would normally have 6 people working in the space. Now it's 1, okay? So that's how they've managed the social distancing. There's basically a 1/6 of the number of people in the office compared to what there would normally be. So I want to show you this little setup here. One of the rooms in the building has been given over to filming remote interviews, doing FaceTime, using FaceTime or Skype, something like that. So they've kitted out this room with a couple of fixed cameras. This fixed camera here, the leaf shot, and there's 1 or 2 others in the room as well that help build a sequence. So a very common sequence within a television news package now, or in a documentary or current affairs program, is the shots of the reporter looking at the person doing a who's talking to them via FaceTime. Okay, it's not the most fascinating, brilliant television you're ever likely to see, but it does the job. It's another sequence in a situation where you don't have too many pictures to play with. Final thing I wanted to show you is the studio. So you'll have seen this on the news on Match of the Day. Any studio-based program at the moment, there's plenty of distance between anyone who's in the studio, between the presenter and the reporter, if they're perhaps doing a two-way. Yes, it's kind of changed the way we're working away. You there's just a few things that you add to the routine. You go in, you get your temperature checked, you put gel on your hands, you go to your desk, there are wipes available on the desk, so you wipe down anything you might touch, the keyboard, the mouse, the telephone, the hands, the rests on the chair that you're using, the armrests. Give it all a clean. Any surface that you might touch, you give a clean, and then you get on with your work. And of course, every time you go out for lunch, or you go to the loo or something, you come back and you go through the same routine pretty much again. So again, it does take a little bit longer, but it's manageable. And it's one of the things, like I say, it gives me hope that the university can do this and make sure that we can get into the building, do some face-to-face teaching and do it safely. A couple of little things I wanted to pick up on from what Anna said, and realise we're running out of time. It's something of a summary. I mean, I think the biggest changes in terms of the way people work are, as Anna said, carrying out remote interviews. So do interviews via Skype, FaceTime or similar, and recording them. More use of mobile technology, partly to carry out those kind of routines. But you'll have seen in the slides that Anna was showing, mobile phones are also being used to gather shots as well, because they can go places that some cameras can't. And you can be distant with a mobile in a way that you can't always with a video camera. Then there's more UGC is used. We're definitely using a lot more user-generated content now. Sometimes that's gathered via social media platforms, so it's photos and videos that we see on Facebook and Instagram and so on and so forth. We ask the people who've uploaded it if we can use it for our news programs, and we take it from them. But sometimes, as Anna was saying there, it's actually about directing one of your contributors and getting them to do the filming for you. That's a very different way of working. I've not known that happen before. That's something that's just come in for coronavirus. It's a new kind of part of the process that journalists go through now. So I would say those are the key differences and changes in the way that people work as TV reporters when they're out in the field. Yeah. I think as well, there's a couple of things there. Sorry, Anna, just to say, to finish off, in terms of ideas maybe for doing research, if you're doing a dissertation, I wonder how much people care about the drop in production values. I mean, we care about getting shots in focus and having them properly framed and the right colour and all of that. And you've studied doing this, and I've worked hard to kind of learn skills to be able to teach you it. But I do just wonder how much the viewer at home is concerned about these things. I think that'd be an interesting thing to study. I'm sure there will be people studying that kind of thing now. Might be a dissertation topic for somebody who's not doing a documentary. I think similarly with the user-generated content side of it as well. Academics have been writing about UGC, about citizen journalism for a long time. I think that's changed a lot in the last few months. We're more reliant on citizen journalists, if you want to put it in that way, on UGC than ever before. And there's a closer relationship, a working relationship, very often between contributors and reporters now, in a way that there wasn't previously. So that could be another thing that you might want to study along the way.
Yeah.
What are you thinking, Anna?
Yeah, no, I agree. And I think a lot of this, we've had to adapt, we've had to change, but it's in many ways it's been quite good, because it's pushed us, and we're looking at new ways of working. And actually, some of the things that we're doing now, we think, why weren't we doing this before? Because it can be done. And actually, I don't think, we thought that the viewer had to have these beautifully crafted shots and everything had to be beautifully done. And we can't possibly have someone filming something for us on their mobile because the audience wouldn't like it, and they'd know. But actually, this has shown us that at the heart of journalism, and TV journalism especially, is good storytelling. So if you can tell a good story, if you've got a good story that's interesting and you can tell it well, then everything else should fall into place. And like I've said, you may or may not have to think about these things for if you choose to do a TV documentary or even a radio documentary. If that's what you choose to do, there may be some restrictions on you, but it's completely doable. It's just new ways of working. And actually, in many ways, you guys will be better at grasping this than me and, dare I say, Ian, you know, because we're old school, whereas you're more used to working with your phones and, you know, working using user-generated content and sharing things. So I think this is probably a really good time for you guys because you're more used to it. And yeah, I think the possibilities of what you can do now are endless. But you know, if you do have to do things like that, if it does come to the point when you're doing your final project, if you do have to do things differently, don't be frightened about that. Just embrace it because it can be done. Well, you're on mute, Ian. Ian, you're on mute.
I'm on mute. Teaching you again the pitfalls. This did the rounds of social media, so you may have seen it before. I just wanted to share it with you. So here's an innovative use of technology. We have here a mobile recording device and what I can only describe as a mop. So this is the kind of innovation we're looking for, folks. If you can bring a bit of moppage into your filming, we'll be highly impressed.